year ago last fall as the right way to go, and the Tim Hortons that they subsidize and so on. That is the best way to create jobs and grow the economy. Lower the HST, pay for it by stopping wasteful government spending, create more jobs. Only one party is talking about that. They're the party of debt. They're the party that hides it. We're the party that stops it in its tracks and creates real jobs for young Nova Scotians. Thank you, Madam Speaker.
Now recognize the House Leader for the Progressive Conservative Party.
Thank you very much, Madam Speaker. I want to thank everybody for a great debate. That concludes the business for today. So I'll let the Government House Leader to tell us what else is going to be going on tomorrow.
Now recognize the Honourable Government House Leader.
Thank you, Madam Speaker. I wonder with the consent of the House, can we revert back to tabling reports of committees?
Is it agreed?
Agreed. Okay.
Agreed. Tabling reports of committees. Recognize the Honourable Minister of Justice.
Thank you, Madam Speaker. As Chairman of the Committee on Law Amendments, I am directed to report to the committee has met and considered the following bill. Bill number 51, an act respecting certain financial measures, and the committee recommends this bill to the favourable consideration of the House without amendment.
Thank you. Recognize the Honourable Government House Leader.
Why, thank you, Madam Speaker. Madam Speaker, it's my pleasure to call business for tomorrow. We will meet from the hours of noon to 6 p.m. And after the daily routine and question period, we will be doing bills for third reading. Bill number 3, 32, 36, 37, 42, 54, and 57. Bills for second reading, bills 67, 69, 70, 71, 72, 73, 74, 75, bingo, and committee of the whole, Mr. Speaker, Madam Speaker, on the whole House on bills. With that, Madam Speaker, I ask the House to now rise to meet from the hours of noon to 6 p.m.
The motion is that we do now rise to meet again between the hours tomorrow between the hours of noon and 6 p.m. All in favour say aye. Those opposed, nay. The motion is carried. We have reached the moment of interruption. We now proceed with adjournment debate under Rule 5.5, submitted by the Honourable Member for Lunenburg West, which reads, therefore, be it resolved that unlike the previous Liberal and Conservative governments, the NDP government's plan for healthcare is putting patients first while reducing administration costs. Now recognize the Honourable Member for Lunenburg West.
Thank you very much, Madam Speaker. Thank you very much, Madam Speaker, and I really do appreciate that. I heard on the news just a while ago that today is the International Day of Love, so I'm expecting a wave, a veritable tidal wave of love to come from that side to where I can already feel a little bit of it coming that way.
What's not to love?
What is not to love? Anyway, to debate the resolution that, unlike previous Liberal and Conservative governments, the NDP healthcare plan is putting patients first while reducing administrative spending. And I'm very pleased to speak on this because, in all seriousness, it is a very, very complex and important issue for our province. And I'm sure many are aware that healthcare continues to be the largest portion of the provincial budget. I think we all know that. In fact, the healthcare budget accounts for about 41% of our total provincial spending this year, and I think that equates to roughly $3.9 billion with a B dollars. Madam Speaker, under previous governments, healthcare budgets had been allowed to grow at an unsustainable pace, and that's been talked about in here quite a little bit. In fact, for a long time, this province saw the healthcare budget increase roughly 6 or 7% per year, and that clearly was not sustainable. And yet, despite those increases to which I just referred, there was no real improvement in healthcare outcomes, and that's kind of the very sad part of the whole thing. It was clear, Madam Speaker, when we formed a government that we had to do things differently within our healthcare system, and we knew we had to find innovative and better ways to deliver services while reducing unnecessary spending. And our government was not content to repeat the failed health policies of previous Liberal and Conservative governments. So we knew we had to make a change. Not easy to do, a lot of planning involved, but we set about doing it. We knew, for instance, just as an example, that paying nurses to leave Nova Scotia, I think to the tune of around 1,000 of them, and like the Liberals did, would devastate our healthcare system, and that applied as well to closing hospitals and acute care beds. I think during a previous Liberal government, about 1,500 were closed. And let's remember that it was the Liberals who invented the unfair and, I would say, downright cruel practice, Madam Speaker, of charging seniors for health care in long-term care facilities. I think we all remember that. A practice that forced people to sell their family farms or homes and hand over their life savings to the bureaucracy. Those were bad days, indeed. And the Liberals seem to be masters of creating bureaucracies that waste lots of money, and I'll talk about that in a second. They created the current health boards and the individual bureaucracies that accompany them, and now they once again think they can fix health care by building a bigger, I don't know, let's call, what are we going to call it? The super bureaucracy based in Halifax, a Halifax-centric bureaucracy. Super board. As usual, Madam Speaker, the Liberals are out of touch with Nova Scotians who only want, this is what I think Nova Scotians want, they want better health care. They want better health care sooner. Nova Scotians want to know that when they need health services, they can get them. And they want to know that their emergency rooms are going to be open. And not that long ago, people couldn't be sure that their ER would be open when they needed it. The former Conservative government was frozen with really no plan for emergency care, and both of those parties were ready to give up on ERs. And both the Liberals and the Conservatives said 24/7 access to emergency departments couldn't be done. Well, Madam Speaker, we said, just watch us, and we did it. We did it. Our collaborative emergency centres are ensuring that in communities across Nova Scotia, the people who need emergency health care are getting it any time of the day or night. And for instance, in Tatamagouche today, residents know that they can rely on their ER. Just a couple of years ago, the emergency room there was closed on almost a weekly basis. In just 6 months, Madam Speaker, in 2011, the Lillian Fraser Memorial Hospital in Tatamagouche was closed 856 hours. Just 1 year later, with their new CEC in place, that number had dropped to, are you ready for this? 13 hours from 856. Madam Speaker, that's significant. And I'll table this. And what this says here is comparison of CEC closures, closure hours from date of opening to ED closures, emergency department closures, in same time period for the previous year. Here we go. South Cumberland Community Care Centre, Parsbro, closed 426. Under the new plan, closed 12. All Saints Spring Hill Hospital, 688 hours closed before, with the new CEC, 20. Tatamagouche, just mentioned that one. Lillian Fraser, 856 down to 13. Annapolis Community Health Centre, 60 down to 0. North Cumberland, 64 down to 0. And I'll table that. So today, thanks to the NDP, a mother in Tatamagouche who needs to take her child to the ER, and we're getting lots of screaming over there, Madam Speaker, but a woman in Tatamagouche who needs to take her baby to the ER during the night knows that she can. And what will the Liberal super bureaucracy do for her? Well, zippo, nothing. In the last 4 years, Madam Speaker, we've turned the corner on the ER crisis in Nova Scotia, and we can't go back now. I know they want to go back. I know the member from Cape Breton North wants us to return to the bad old days. Not going to do it. So let the Liberals and let the Conservatives focus on health bureaucracy. Let them do that. Let them take this plan to Nova Scotians. Let them do it and say, this is how we'll fix health care. We'll build another big bureaucracy. That won't solve the problem. In the meantime, Madam Speaker, we're just going to continually keep on fixing health care. In just 4 years, we have found ways to save money that doesn't impact on care, Madam Speaker. We're saving money by buying prescription drugs in bulk, something that was never done before, and by putting a cap on generic drug prices. Our shared services initiative is reducing redundancy and freeing up money that can now be spent on frontline health care. And this initiative is already resulting in millions of savings, and there's still much more work to be done, and we know that, and we're going to keep doing it. We're cutting up to 20 senior executive positions, and we've reduced administration spending from above the national average to below. I think the Minister of Health in this House today mentioned that. We're below the national average. We were way above it before. And we've done this, Madam Speaker, through moderate, measured changes that won't throw our system into chaos, as happened in Alberta. We are already saving $8.8 million per year without affecting patient care and without moving all healthcare decision-making out of local communities and into Halifax. We do not want to move healthcare decisions out of the regions. The people in the regions know what they need, and we're going to listen to them. The Liberals' plan will throw the entire system into chaos, as it did in Alberta in 2009. Now, this is what happened in Alberta, Madam Speaker. 5 years and almost $1 billion later, 5 years and $1 billion later, Alberta has seen worsening frontline care, doctors leaving the province, and almost no administrative savings. In fact, just last month, Alberta announced that in order to reduce admin costs by 10%, they would freeze salaries and implement a hiring freeze in health administration. That's the Liberal plan. That's the Tory plan in Alberta. That's not our plan. So, since the creation of the super bureaucracy in Alberta, emergency room doctors have revolted, paramedics have called the system on the edge of failure, and the head of Alberta Sciences Association said the situation has gotten so out of hand that we now have patients calling 911 from the ER because they waited so long in hospital emergency departments. Can you imagine, Madam Speaker, patients are calling 911 from the emergency department. And I'll table that. I'll table those documents. I'm tabling it. In contrast, Madam Speaker, in Nova Scotia, ER closures are down. Patients are getting better care and through CECs and through 811. And Nova Scotia has the best, most stable relationship with frontline healthcare workers that we've had in decades. We've done it with the cooperation of X-ray technicians, lab technicians, and doctors.
Order, recognize the honourable member for Kings West.
Thank you, Madam Speaker, and pleased to join in late debate today. I'd have to say first, right off the mark, that the member for Lunenburg, I believe, perhaps lost some pages along the way. It was Lunenburg West, sorry, from Lunenburg West. Definitely lost some material on his way here for late debate. First of all, look, you know, anytime we have people, you know, in front line that's able to provide primary care, such as we have in all but one CEC, we have to remind Nova Scotians that they do not have emergency care. In fact, in the CECs, the nurse and the paramedic, the PCP, in fact, they've had to call 911 because they can't deliver clot-busting drugs. They can't do the emergency work. I think it's a great thing. It's a great comfort to have somebody available, but it is not an emergency care, and that's what we need to know, and that's what the communities now are starting to discern. You know, they can go there and they can make an appointment for the next day with their doctor, which I think is a very, very good thing. So what the member from Lunenburg West really forgot to tell us is the kind of the state of the union about where we are in terms of some of the measurables of healthcare in the province. And I was hoping that he was going to talk about the 2,200 plus patients waiting for knee replacement. You know, that's what's on the minds of Nova Scotians. And he conveniently forgot to state that 85% of those waiting for a knee replacement have been waiting longer than the national average. That's the reality that we're facing in our province. Those waiting for a hip replacement also didn't make the honourable member's remarks. 867 were waiting as of last month, 72% of whom are waiting well beyond the national benchmark. And, you know, even with the blitz, we didn't reach the goal that was outlined there. So, you know, I think the honourable member's speech also lost another page along the way, which highlighted that over 4,000 patients are waiting for cataract surgery. And 47% of these 4,000 have been waiting longer than what has been deemed to be a national benchmark. So, you know, I think anytime we stand in our place, we need to talk about some of the realities that do face us here in the province around healthcare challenges. And, you know, when he talks about the emergency rooms being open, the emergency rooms are open, but they're not providing emergency care. They're providing primary care. And so, but he also should have told us about the overall picture of emergency rooms for the province, which the last year that there's statistical data available for, 17,717 hours of emergency room closures. That's the reality, Madam Speaker. So I guess that page managed to slip out of the honourable member's speech as well. And to do the math on that, that represents 738 days worth of closures. Madam Speaker, you know, really we have almost 2 years worth of closures in a year. So it's hardly a record to be proud of, especially when it was the NDP government. We all know that in the election of 2009, one of the major promises was that emergency care, emergency rooms, the one at Soldiers Memorial, the one in North Sydney, that those would remain open. The one in the Honourable Government House Leader in New Waterford, that emergency room would remain open. And we know that is not the case. So, Madam Speaker, recently Capitol Health released its Strategic Indicators report, and the results are telling. Average wait time in February 2013 for an MRI. Definitely a page missing on this one. 201 days waiting for an MRI. Close to 7 months, Madam Speaker. And let's not forget, Madam Speaker, an MRI is a test which will determine a future course of treatment and does not represent the full weight patient would endure. So there are no targets being met in any of the major emergency departments with Capitol Health. In fact, Madam Speaker, the average wait that a TAS Level 3 patient waiting to see a physician at the Dartmouth General is 170 minutes. 170 minutes, and the standard, here's the standard, is 30 minutes. 30 minutes. Halifax Infirmary, the wait for TAS Level 3 patient is 150 minutes, and the standard is 30 minutes. So, Madam Speaker, for the benefit of the honourable member, a TAS Level 2 patient is classified as having an urgent condition that could progress into a more serious problem. So I would challenge the honourable member to speak to these patients to see whether they believe the NDP healthcare system is serving the patient. We all know, you know, one of the areas that we thought we would see progress over the last 4 years, Madam Speaker, and that is in the area of recruitment and retention of physicians. And I know the Honourable Minister of Fisheries and Aquaculture would love to stand here today and tell the House and put on the record the phenomenal need of general practitioners in his community. And I believe that is going to be one of the things he's going to hear on the doorsteps come soon. that I don't have a family doctor. I rely on the emergency room. And I know in parts of the valley, that's going to be on the minds of people. I don't have a family doctor. And so with 50 to 60,000 patients who don't have family doctors in our province, this is a major, major health concern. Just today, I met with representatives of the Canadian Cancer Society. And the fact is, without a family doctor, some of that early detection just does not take place. And as a result, we have Nova Scotians that are progressing to an advanced level of cancer before they show up at an emergency room and realize that they are being told that they have a very serious problem. So, you know, and right now, when we take a look, other communities needing physicians, and I'm surprised that the member for Lunenburg West did not point out that in his area, Bridgewater, Caledonia, Chester, Lunenburg, Mahone Bay, New Germany, all of these communities are in need of family physicians. In fact, down in Southwest Nova right now, the call is out for 14 physicians. So that page definitely fell out of the honourable member's prepared speech for today. You know, we have lost a world-renowned specialist in Dr. Ivor Mendes. We've lost Dr. Don Weaver. We've lost what will prove to be, I think, one of Canada's finest orthopedic surgeons in Dr. Andrea Wolkovich from the Valley. So, you know, these are departures of specialists, and I think they speak for themselves. And, you know, the honourable member railed about making substantive changes in the way we deliver health care in the province, and we know that we have to change the way we deliver health care in our province. In just 1 year, the new federal health accord is going to give us less dollars. We have to move every practitioner onto the front line that we possibly can in order to look after Nova Scotians who, in just a very short time, we will have 1 in 4 moving on to 1 in 5 Nova Scotians who are senior citizens. So, Madam Speaker, we do need change, and with that, I take my place.
Now recognize the honourable member for Argyle.
Thank you very much, Madam Speaker. It's my pleasure to stand and speak to this this motion submitted by the member for Lunenburg West, and I'm going to echo a lot of the things that that we've heard from the member for Kings West, and it's sort of the story of all the things that we're missing from the member for Lunenburg West's from his speech. That probably was prepared for him by the NDP caucus office to try to come up with good things to say. You know, the MRI thing, we were thinking, I need to thank staff for this one. You know, the wait for MRI is longer than the wait that they're going to have to make the Muskrat Falls decision in the UARB, right? The 6 months wait period for the UARB decision. Well, people wait longer for an MRI than that, which is frustrating for me, who came from a government that brought in the largest number of MRIs into our province to make sure that the ratio per population was one of the highest, and to see that it's being squandered. That opportunity is squandered away by a system that has not changed. Matter of fact, it's gone backwards since this government took power a long time ago, 4 years ago. And we keep hearing worse things. We keep hearing worse things. You know, if I talk to the member for Cape Breton North, and I ask him, you know, how's your ER doing? And you know what the answer is that you got to call ahead of time. How many emergency rooms do you know in the province of Nova Scotia that you've got to call ahead of time to make sure that it's going to be open? Because it's closed way more than it's ever opened. So just for those people who are watching TV today, in case you don't know the number, 794-8521, call that phone number to make sure if the north side emergency room is open, because it is closed more than it's open.
Order, please. I'd like to remind the member that it's not appropriate to offer messages to the viewing public. The debate is held within the chamber, so just be mindful of that in the further debate. Thank you.
Thank you very much. Or maybe for the member for Kings West, if he happens to be in Cape Breton North, he can call that phone number just to make sure the emergency room's open. Maybe the member for Shelburne, Minister of Fisheries, if he's up in North Sydney, if he's got a problem, I would suggest that he goes somewhere else. You know, no, I'm hearing from the member for Shelburne talking about things, and maybe we should talk about how often Shelburne has been closed lately. It has been closed, it's been a little more than that, Mr. Minister, a little more than that. Let's talk about Digby and how much that one's been closed, which has been absolutely phenomenal. Soldiers Memorial in Middleton. You know, again, probably closed more than it's open. So as much as this government continues to talk about the CEC program, it's not an emergency room, number one. And it's not in every part of the province. So what they really need to be doing, that if they believe in this program so much, then roll it out. Roll it out right across the province. Put one in Shelburne, put one in Digby, put one wherever we're having these problems. And let's see how things are working. 17,000 hours of closures across the province, over 17,000 closures across the province is not acceptable and nowhere further ahead than we were 4 years ago. No, because they said they had a better way. They promised that they had a better way. They promised even further than what they had provided, which was to provide emergency room service 24 hours a day, 7 days a week. That's what the promise once was. That's what the Premier said when he was talking to Nova Scotians and trying to get them to vote for him during the last election. Let's not forget that of what the actual promise was. Now, the added problem that we're going to have that the Minister of Health has not been able to answer for us up to now is that how are the CECs going to be able to work when the paramedics might be ending up out on strike? I want to see how that one is going to work. Because, Mr. Speaker, or Madam Speaker, what's happening here is not only are our paramedics upset with the way that they're being paid and a whole bunch of other reasons, but they do provide a very important service to the CECs as those PCPs offer that next level of service to work collaboratively with the RN or the nurse that's on duty. So without them, what are we going to do? And a matter of fact, the CECs have exacerbated the problem of how many hours you actually can work in the northern part of the province, because what's happening is that's taking up 30 and some odd shifts a week that paramedics are moving off to work at the CECs and unable to come back and work in the paramedic system within the ambulance system because they're working more than 12 subsequent hours. So what's happening is that ambulances are rolling out across this province right now with one paramedic on them. And I don't know about you, but I had an opportunity once or twice to be in an ambulance. How can they actually work on the person that's in the back of the ambulance when you're driving it? You can't do that. That is the danger that this government has started to create in doing one thing without realizing that it has an impact on something else. Always seems to be the problem. You know, the no doctor issue is one that, you know, that was probably the most frustrating line out of my briefing book that I had to read on a regular basis. When we talked about the availability of doctors in the province. And of course, what's the first line that comes out of this minister's mouth and out of the previous minister's mouth was that, well, we have more doctors per capita than any other province. Well, great, wonderful. Well, what I couldn't say when I was sitting over there is that, great, they're all in Halifax, and it doesn't mean a hill of beans for somebody who lives in Yarmouth, or somebody that lives in Antigonish, or somebody that lives in the Valley, or South Shore, because they're all here, and you can't access them. Madam Speaker, what happens to my family, my brother and his wife and his daughters, they actually have to drive to Tantallon. From Yarmouth, they drive to Tantallon so they can go see a pediatrician. That's not acceptable. As we move forward, and you know what, there were some great ideas in trying to make sure that we train our own doctors at Dal Medical School, try to provide the seats that are available to them so that we can roll them out into places that we need them in Nova Scotia. Where is that? And a matter of fact, they botched that one up too, because what happened when New Brunswick pulled out of the med school here to create their own in St. John, there were even more seats available to Nova Scotia to be able to access that, to provide training for more family physicians that we can use all around the province. What happened to it? They all went to, I believe, Saudi Arabia or somewhere in the Middle East. Because this government, that minister, couldn't find a way to make it work, or did not understand the implications of making something like that work. Too many people in Southwest Nova Scotia, whether they live in Barrington, whether they live in Woods Harbor, or Pubnico, or Argyle, or all right around that area, there's lots of people that still tell me on a daily basis I don't have a doctor. Or even worse, I had a doctor, I've had 2 or 3 doctors, but they keep leaving on me. And every time that I hear that minister say that we have the CAP program, we have the training, we train international students or international doctors, that's great for a year, and they get their training and they move off to Toronto or they go where they want to practice because they don't want to practice in Southwest Nova Scotia. Why don't we find students that are smart and ready and willing and able to go through the med school program right here at Dalhousie University and go back and work in their own hometown? Wouldn't that just be it's almost so easy that it's almost, it's almost logical. Thank you very much to the member for Dartmouth North. Madam Speaker, what the member from Lunenburg West didn't say is that things have gotten worse since this government has taken power. Absolutely worse. I continue to hear from many Nova Scotians, and maybe they're not hearing from them because they apparently are turning a deaf ear that healthcare is still not an important thing in Nova Scotia. Maybe that's the corner they haven't been around yet. Madam Speaker, I think we should invest more in healthcare. We need to find better ways to use find the efficiencies that things work, and find the corner of the cliff. They're so far around that corner, they'll never find their way back. Madam Speaker, thank you very much for the opportunity to speak tonight. I just hope that this government can do better, or it's time to replace them.
Thank you. I'm going to thank all members for an engaging debate. We will now rise to meet again tomorrow at noon. Have a great evening. High noon.